So I'm speaking to Jon Luxton, who is the Disability Equality Advisor to the Welsh Government. So he's got his hands full. And he's going to talk to us about how the locked-out report came about, what led to it, and what the consequences are of it. So, Jon, over to you. What was the initial impact of COVID on disabled people in Wales?
Well, before we knew the impact, we decided that we really had to look at the very ethical and moral basis of some of the work that was being done in Wales. So right at the very beginning of COVID, we looked at with a degree of horror at the guidance that came from NICE, that came from the BMA, et cetera, et cetera. We saw that and we thought, we cannot let this stand in Wales. So we created an ethics group, which included representatives from all the hospital trusts, with academics, disabled people, many disabled people, all involved to try and come to some kind of more ethically based health action in Wales. Because I don't know if you remember these things, Richard, but we had a situation whereby the NICE report was saying things like, if you are somebody who receives direct payments or any form of social care, then you would not be getting a ventilator. We had other reports, other piece of the guidance that said, if a disabled person was using a ventilator to their benefit and a non-disabled person needed it, then you could take it off the disabled person. So we had these horrendous things that were being placed at the heart of our medical institutions as a guide for how they should work with disabled people in COVID. So before we knew the death rates, we knew there was going to be some kind of horrible potential ethical shortfall. So we worked on that immediately. From about April, May, we heard stories of how various pieces of government legislation was affecting how disabled people was receiving services, or how their care packages were being demoted to a certain degree, hours cut, et cetera, et cetera. So we quickly put in place our Disability Equality Forum, which had been around for many years, but we held many meetings over those next couple of months. So we already knew it was going to be bad, because we also had the figures that were coming up very quickly to do with race. Now, the figures on that clearly showed that if you were from the BAME community, your chances of dying were higher. But it wasn't to do with genetics or a propensity for illness. What it was the relationship they had to their means of production, if you like. These were people who were doing risky jobs, physical jobs, often living in homes of multiple occupation, with intergenerational issues as well. So there might be people who were working, living with their grandparents. So we put together a committee from the Disability Equality Forum, a subcommittee that was completely run by disabled people, and Welsh Government to assist, put in place, led that committee, if you like, its secretariat functions, and also our research team and statisticians, in order so that we could do some work and look into what was happening. It wasn't, I keep reading, it was done in co-production. It wasn't. It was done with the full leadership of disabled people. There's no co-production. Welsh Government input was secretarial. Because all of a sudden we've got world-class statisticians and researchers, with MAs and doctorates in the subject, doing some of the really hard, the heavy lifting. Together, they looked through 300 pieces of evidence, including 170 major reports that were being produced almost daily at that point about the effects of COVID on disabled people and other groups. So it was a huge amount of work, to be honest, that took place. And when we got the report in September about the higher death rate, that work accelerated, because there was now no longer a theoretical belief that it's a problem. It was very, very physical, and ONS provided us the data, so it couldn't be argued with. That all of a sudden, all hell would break loose regarding the media. They're going to see this figure, as they did when we saw the figures, the extra death rate for BAME people, where they were very angry and calling for this, that, and the other. Nothing happened. In fact, the only politicians who actually gave a proper response to that were from Welsh Government. Welsh Government publicised it in the Senate by debating chamber, and just passed judgment how appalling this was, and that how this could not be left to stand. And I believe that it was socio-economic issues that were the root cause of most of these deaths, and that we wanted to actually look at those socioeconomic conditions in order to produce a report that could take us forward post-COVID. Where are the barriers to, to employment, to education, to transport, all these things? So it was the work was quite staggering. That subcommittee of disabled people did an incredible job. It was headed up by somebody called Debbie Foster, and they were looking at health, living standards, social justice, personal security, work, participation in society, all policy areas, housing, overcrowding, deprivation, poverty, transport, and including domestic abuse, because as we know, one of the most horrific byproducts of COVID was an increase in domestic abuse. And of course, disabled people are many more times likely to receive that than non-disabled people. And it was a brave thing for them to do. Of course, we're opening the doors to what they do and what their policies are, and open them up to criticism. So it didn't happen in England,
No, we're still waiting.
No, well, it won't, because, there's a difference between Wales and England when it comes to government. The Welsh government's a socialist government, and it's been, it's there, and it has, a fundamental belief in liberty for disabled people. Of course, unfortunately, Welsh government is not treated by many people in England as a serious proposition. There's a certain degree of arrogance when mentioning it and treating it like a local authority. But of course, when you look at the most progressive things, many of the most progressive things that have happened socially, they started in Wales and Scotland. Those areas were the social model versus the medical model, human rights, health and well-being, social economic disadvantage, and exclusion, accessibility, and citizenship. And associated with each of these 5 sections were summaries, narratives, and of course, most importantly, recommendations. And there was, I think there were 70 odd recommendations across the whole of the report. So it was very, very extensive. And I think it's probably the first time disabled people have just been allowed to go into government with full support of government and say what they truly believe about the situation of their life. And that was an incredibly empowering thing for all those involved, including myself. And I'm there as an advisor, but it just felt good to be part of that. Because we're, getting that voice out there, being heard, being taken seriously by government. Now, in this case, everyone involved already were pretty strong on the social model, but they felt liberated because their voices were being heard. And they understood that government and understood the fact that the social model was key to this work. So the final report was produced in March 2021. And the final report put itself into those, as you know, into those chapters. But what came after it, what was crucial, when we put the report out, the first Minister of Wales, Mark Drakeford, understood the massive importance of this, because a quarter of our population in Wales are disabled people, and they're a group where the words equality and liberation are not often heard amongst the general public or amongst certain companies, organizations, and dare I say it, some local authorities. So there was so Mark Drakeford, he said, well, what we need to do now is to create a First Minister's task force. And a task force is not just like a little committee, it's a task force with powers. And those powers were to work with Welsh Government in a co-production method, using co-production, to actually really try and make real differences to the way work is carried out in Wales, to the way disabled people are treated in Wales, to how policies and procedures impact on disabled people. The first one was bedding in and understanding the social model across the whole of Wales, and that was to look at not just Welsh Government, but looking at all the organisations that we work with. So we'd be rolling out social model training, quite impactful social model training, because social model training can be a waste of time, or it can be something that is actually useful. The second one is about access to services. So this includes just basic accessibility, communications technology, all the ways that access to services can be blocked. And of course, we've got independent living social care. That's a huge issue. And we separated that to independent living, health and well-being, because we wanted to do a particular focus on social care because of the situation with direct payments in Wales. Also travel, it's a huge issue in Wales because we don't have the best infrastructure, but we do have the best transport policy. Again, the same group of people worked heavily with our transport department who produced their policy in 2021. It's the best transport policy in the UK. and it's looking to make all the infrastructure, all the buses, the stations, all of them accessible within 5 years. Oh, absolutely. The last thing we want is talking shops. Absolutely, the last thing we want. We've had enough of them. We're Welsh. We talk a lot. It's talking without action is a waste of time, and people know that. So you're absolutely right. We're really pulling apart policies, improving policies, seeing where things can be better. And that's been done with the full cooperation of a government that's opened up its doors to its own policies. Well, I guess the biggest prospect is having a seat at the table offers the possibility of change being directed by disabled people themselves. Now, how this will unfold, I don't know at this moment in time, because I can't preempt what the disabled people on these various groups want, or what they will, or what they want from government. It's very hard, but we know obviously the big ticket items, and we know where they need to go. But there are many, many things where we just need to open up the doors to people who have experience that I don't have, that government doesn't have, and perspectives which we might not even know exist right now. So that's the important thing of allowing the random, allowing the new in. Go with the chaos. Sometimes out of chaos comes great change.